Thank you, Mr Speaker. My question is to the Minister of Health. Does he stand by all his statements on health services?
The Honourable Tony Ryle.
Yes, including the statement that the changes this member is regularly raising are clearly not the result of this government reducing funding in health, because we have provided DHBs with $536 million extra funding this year and will provide a solid increase in the next financial year.
Supplementary.
The Honourable Ruth Dyson.
Will he guarantee to the people of Taranaki that not one patient-centred frontline health service will be cut as their District Health Board goes through a cost-cutting process, or will he break his election promise again?
The Honourable Tony Ryle.
Mr Speaker, I am concerned about the financial state of several district health boards, including Taranaki DHB, but let's be clear. The government has increased funding for Taranaki DHB by $11 million in the last budget. There will be more of an increase in this year's budget, and none of the changes they may be considering can be attributed to a funding cut.
Supplementary.
The Honourable Ruth Dyson.
When Finance Minister Bill English said that the government was cutting low-value spending, which services in health was he referring to? Home help for 3,000 Otago and Southland citizens, mental health services in Nelson, 12 nursing positions at Palmerston North Hospital, or the 198 Youth Health Centre in Christchurch, which is closing this week? Which of those services, all being cut, does he say are low value?
Mr Speaker, I expect that the Minister of Finance was referring to low-quality spending such as that member opposite's free physio scheme that cost the country $250 million and was proven to be much of a disaster. What I would also say that with respect to the member, many of the changes that she raises in this House are not new. I've received information that shows that in Otago Southland, in the last 3 years of the previous government, reduced home cleaning and support hours for more than 700 people. More than 700 people. I think this is a case of the member suffering from amnesia from the previous 3 years.
Nicky Wagner.
Thank you, Mr Speaker. To the Minister of Health, what improvement in frontline services have happened at Waitakere Hospital?
The Honourable Tony Ryle.
Mr Speaker, staff have completed the first ever hip replacement at Waitakere Hospital this month, and elective gynaecology day-stay procedures are now being done at the hospital. And almost a $2 million refurbishment of the hospital's emergency care centre got underway this month, which will bring full 24/7 emergency care services at Waitakere a big step closer. The emergency department under this government has already extended its hours this year, and this building work means that it will be in a better position to open 24/7 in the middle of this year for children's emergencies and for all patients by the end of this year as target, something that the party opposite promised and never delivered.
Supplementary.
Order. The Honourable Ruth Dyson.
Why have more than 50 frontline patient services been cut and thousands of patients left without frontline health services under his watch?
The Honourable Tony Ryle.
Mr Speaker, frontline services are improving in New Zealand. The member needs to know that we inherited a situation where under the previous government we had $155 million of unfunded services. We've put an extra $536 million into DHBs, and that's why we've got record elective surgery, faster emergency departments, more people getting cancer care, and great developments happening up and down the country.
Question number 6, Melissa Lee. Question number 6, Melissa Lee.